Donna Beckman. I am the Advocacy and Outreach Director for the North Carolina Down Syndrome Alliance, or the NCDSA. I would like to welcome you to the North Carolina Down Syndrome Virtual Speaker Series, which is hosted by NCDSA in collaboration with Coastal Buds, the Down Syndrome Network of Onslow and Carteret Counties, the Down Syndrome Network of Greater Greensboro, the Down Syndrome Association of Greater Winston-Salem, the Down Syndrome Association of Greater Charlotte, and the High Country Buddy Walk. NCDSA will be hosting the 2024 North Carolina Down Syndrome Conference on Saturday, April 27th at Alamance Community College in Graham, North Carolina, which is right off the interstate and easy to get to. Registration is open. And if you are joining us tonight, you will have a link to the conference in the email that you received with the link for tonight. And the 2024-2025 North Carolina Down Syndrome Virtual Speaker Series will continue to run starting in June of this year. I would like to thank everyone for your patience as we incorporate the new technology of using Teams for our presentations. Tonight's session is being recorded, and barring any technical issues, you will receive a follow-up email next week that will include a link to the video and the PowerPoint slides from tonight. I ask everyone to please take 1 minute following tonight's presentation to answer the questions in the survey that was also included in the email with the link to tonight's presentation. Your evaluation helps NCDSA plan future events as well as offer feedback to our presenters. The question and answers will be handled through the Q&A feature in Teams tonight. The chat feature is turned off. If you do not have access to the Q&A feature, please text your questions to 919-532-9207. That number was also included in the email you received with the link for tonight's presentation. So without further ado, I'd like to welcome you to Promoting Mental Health Throughout the Lifespan for Individuals with Down Syndrome, presented by Abby Rowley.
Are you having the whole thing?
Yeah.
Clinical social worker.
Can I take?
Okay, we got it. Thank you. Promoting Mental Health Throughout the Lifespan for Individuals with Down Syndrome, presented by Abby Rowley, licensed clinical social worker from the Advocate Adult Down Syndrome Clinic in Park Ridge, Illinois. Welcome, Abby. Thank you for spending your Wednesday night with us and presenting on this very important topic. And just take a couple minutes to tell us, about yourself, why you do what you do, and passionate about, working with this Down syndrome community, and then just jump right in, okay?
Sure, sounds good. Thank you so much for having me. I'm excited to be able to do this presentation. I've been with the Adult Down Syndrome Center since 2022. And prior to that, I worked in the school system. So working with kids of all ages up through adulthood and with all different abilities and skills. I have an aunt who has Down syndrome. So that's just been a part of my life for my entire life, which is what drew me to this population and to the clinic itself, as she is a patient here. I obviously don't work with her, but she sees our physicians. And so I've gotten to see through her life the ups and the downs and some of the concerns that she's gone through, which is really brought me here and is a passion of mine. So I will get started. My presentation is Promoting Mental Health Throughout the Lifespan for Individuals with Down Syndrome. And let's see, I work at the Advocate Medical Group Adult Down Syndrome Center, as Donna mentioned. About our clinic is that it opened in 1992, and the physicians have seen over 6,000 patients with Down syndrome. Our mission is to enhance the well-being of people with Down syndrome who are ages 12 and older by using a team-based approach to provide comprehensive, holistic, community-based healthcare services. We have 4 physicians, an occupational therapist, myself, patient advocates, as well as nursing staff together, working all together at the center. Please note that this presentation is intended for families, caregivers, healthcare professionals, and service providers of people with Down syndrome. The information in this presentation is provided for educational purposes only and is not intended to serve as a substitute for medical, psychiatric, mental health, or behavioral evaluation, diagnosis, or treatment by a qualified professional. So we recommend that if you have any specific questions about your loved one, that you bring that to a medical provider. The purpose of this presentation is to inform. This is sort of my personal disclaimer at the beginning that mental illness, mental health concerns, they happen just like physical illness or physical health concerns. So this presentation is really just to help you prepare, plan, prevent in some cases, or cope with various situations. I always like to make it known that each individual person has an entirely unique combination of genetics and environmental influences, and we see this in our lives with every person we know, right? Even siblings brought up in the same families, in the same system, can have vastly different outcomes in terms of their physical and mental health. So mental illness is like physical illness in that it sometimes happens. There are things that we can do to help prevent or minimize its effects, but at other times there are things that just happen in life. So I say this because I don't want anyone's takeaway from this presentation to be that you've done anything wrong or there's something you could have done differently to prevent. It's really just to provide the perspective of now working with adults, adolescents and adults. There are certain situations or concerns that I hear on a regular basis, and families saying things like, oh, we wish we had known this when they were younger or when they were back in school. So this is just to provide that perspective about things to sort of keep on your radar, and different things you can do to support your loved one with Down syndrome. So basically what I'm going to go through is review the common characteristics of Down syndrome, discuss concerns and topics at different ages and stages of life. I'm going to discuss general strategies to promote mental health and discuss additional treatment approaches. So I always like to start with the common characteristics of Down syndrome. These are things that many people with Down syndrome, certainly not all, exhibit, and to varying degrees. So the first one is the groove, and that is what we describe as a tendency towards sameness or routines. We find many of our folks with Down syndrome really like their set routines and the habits they create for themselves. And so that's a pattern we see quite often. We also see self-talk in our individuals with Down syndrome, and we view that as their way of processing, coping, analyzing different situations, and so that's a really common characteristic that we notice. We also know that many people with Down syndrome are very concrete thinkers. Thinking in abstract terms or about gray areas can be challenging for them. Um, we also know that people with Down syndrome tend to have very strong visual memories. So if they've seen something or experienced something, they keep that in their mind and then they replay it often like it's happening in this current moment. And we see how that plays into mental health quite a bit. We also know that people with Down syndrome tend to have a very strong empathy radar, meaning they pick up on the emotions of others. They may internalize feelings of others and feel like they need to act or want to respond when other people are experiencing strong emotions. So, the connection with common characteristics and mental health is that generally we say none of these things are a problem until they are a problem. So the groove, if people are highly regimented and strict about certain routines, sometimes it's a fine line. Well, is this the groove and their tendency towards sameness, or is this sort of inching over into the realm of OCD? We also see with self-talk that some people question, is this a normal behavior or are they hallucinating? Are they hearing voices or seeing people who are not actually present? Same with visual memory. If they're replaying memories over in their head, it may be seen by some people that their behavior is indicative of having auditory or visual hallucination. And then the empathy radar, if they're around other people who are maybe also are maybe experiencing mental illness or mental health concerns, and they're internalizing that or picking up on that, we question, do they themselves have a mental health concern, or is it that empathy radar coming into play? We always talk about some of these characteristics. s- They can sometimes be frustrating or confusing or bothersome to family members. So we always ask, are these behaviors that they're engaging in, are they problematic, or are they just a little annoying? And do they need to be addressed, or is it something that we can live with, and go about our days? Um, we know things like the groove can be really useful if it's functional. If their groove includes waking up in the morning, exercising, taking medication, showering, all that good stuff, that's a really great groove. When we start getting concerned about OCD is that if it's not a functional routine, if it's causing them distress, things like that. So we want to look at how these common characteristics may play into or affect mental health. But we do know that these common characteristics can also be positive and protective factors. For example, self talk is a really great coping strategy for a lot of our patients that we see because to some extent, we all engage in self-talk. Some of us don't speak it out loud, but after a hard day at work, when we're in the car on the way home, we might, be thinking or talking ourselves through various situations as a way to cope. And our loved ones with Down syndrome do that too. They may just do it out loud. Um, the reason that I like to go over these common characteristics is because family members and caregivers, your awareness of these common characteristics can help prevent misdiagnosis or misunderstandings. We've seen quite a few patients come into our clinic with diagnoses of some serious diagnoses of psychosis or OCD. And once we're meeting with the patient and the family, we don't necessarily agree with those previous diagnoses based on what we know about these common characteristics in people with Down syndrome. So your awareness can really help sort of advocate for your loved one or the people you care for. Um, if you're working with a provider who maybe is less familiar with these common characteristics. All right, so we can get into, I'm going to go sort of through the lifespan, talking about some different ways to prevent or to promote mental health, starting with childhood. So we know that children have lots of emotions and they express them. So some issues of concern that we've heard and that we see in children with Down syndrome is that there's a lack of awareness of their emotional state or or that they suppress different emotions. We hear from a lot of families and a lot of adults with Down syndrome that somewhere along the line they got the message that being happy is good and being sad or angry is bad. And so oftentimes when we ask our patients, how are you feeling? Even if they're crying, even if they're visibly upset or angry, they'll tell us, I'm good, I'm happy, because they think that's what people want to hear. And maybe they've learned that people want you to be happy, even if that's not the case. So, some strategies for mental health promotion, starting with one of the most basic, is co regulation. And this is something that we're familiar with going far back as when we have babies, right? So, you regulating your emotional state helps regulate another person's emotional state. So with when we think about young children, we think about holding them, patting them on the back, using a gentle tone of voice, sort of validating their emotions. That's sort of the starting point for helping individuals learn self-regulation skills. It goes from co-regulation with another person, and eventually they learn the skills where they're able to do it on their own. We also talk about in childhood about the idea of emotion identification. This is something that we talk a lot about in our groups and our individual sessions with our patients. We find that they have a difficult time identifying the bodily sensations of different emotions. And so we really work hard at pointing this out, saying things like, is your heartbeat going fast? Are you breathing quickly? Does your face feel hot? Are your muscles tense? So we want to help them identify various emotions. We also teach that all emotions are okay, even if all behaviors are not. This is a big thing that we work on. There's difficulty distinguishing between emotions and behaviors. And so we can be angry. It is normal. It is healthy to get angry, but it's not healthy and productive to harm yourself or others or damage property when you're angry. But we want to validate it is okay to be angry. It is okay to be sad so that they get more comfortable expressing those emotions when they arise. And again, just teaching ways that we can safely express emotions in healthy and positive ways. We as adults or caregivers with young children, we can model safe and positive coping strategies. We can talk through them on our own. And I'm going to get to that in the next slide. And parents and caregivers remind their child, the young individual with Down syndrome, that they're loved, they're cared for, no matter what their feelings are. We don't want to sort of start in that headspace of, I have to be happy all the time, I have to be good all the time for other people to accept me. We can accept all the different feelings. All right. So moving into coping skills, some issues that we see starting in childhood and going up through adolescence and adulthood as well is that there may be a lack of coping skills or difficulty communicating needs, which then plays into their ability to cope. Um, so these are skills that all people need, and we often use a lot of visual supports in our patients because we find that that's a way that they learn best. So, some strategies for mental health promotion are we want to teach them to learn how to handle various emotions. And so we can model good coping skills that we ourselves use. We can model and say out loud, I'm taking deep breaths to calm down, or I'm feeling really stressed out. So I'm going to go take a break in my room or drink some water, really talking through your emotional state so that they can see, oh, it's normal for people to get upset. And it's also normal for people to have strategies that help them calm down. We also suggest providing multiple ways to communicate wants and needs. So that might be using visuals or gestures, words, whatever might help the individual express themselves. We want to give them that opportunity to do so. Distraction and avoidance can be used when necessary, but we really want the individual to learn coping skills. So I know it's really tempting. And as parents, there are times and places when we all just have to do these things, that it's tempting to sort of avoid situations that cause strong emotions, like, oh, we don't want to go there because we know that's going to cause a meltdown or that might cause a tantrum. Um, or we might want to just distract away, being like, oh, yeah, well, forget about that because later we're going out for pizza and it's going to be all good. And I know that there is a time and a place for that. However, we don't want that to become the norm because we really do want to validate feelings without being too quick to try to turn it around for the individual, because that sort of sends the signal that we're not going to experience this emotion or we're not going to learn the skills to work through the various emotions. And it's really important that they learn that. It's a life skill because we're all going to get frustrated. We're all going to get sad at times. And so it's important to learn the skills to handle all those feelings. Um, Validating feelings, we all need this, right? So a quick way to calm kids down is to sort of, when they're upset about something, repeating back, I hear that you're upset, you are frustrated, or that wasn't fair when that happened. Um, that helps them go through the self-regulation process rather than sort of turning around and being like, oh, it's not so bad, things will be fine. We all want that validation as adults as well. So it's good to start teaching it with our kids. We talk about calming and coping strategies. One thing I've noticed, and even working in the school system with young children, is that we often teach really great calming strategies, things like deep breaths, drinking water, taking a walk. And those are super important for everyone to learn about ways to manage our emotions in the moment. We also like to teach additional or long-term coping skills because we find in our patients that with that strong visual memory, they might still be upset about something that happened many months or even years ago. And so we want to help them learn those coping skills that they can use long term. Staying calm in the moment, taking deep breaths, but then also, what am I going to do with these feelings? I'm still upset with my friend, or I'm upset at my teacher. So, teaching coping skills like using I statements or compromise, those are good strategies to help long term. I also did want to mention about the idea of coping with death or with loss. There was no real good point in the presentation to put this in, so I'm going to drop it in here. I'm a big proponent of discussing tough topics like death and loss in an age and developmentally appropriate way, um, starting in childhood, because we never know when we're going to experience a death or a loss of a loved one or a friend. And so it's good to start talking about these things in childhood and being as honest and open as is developmentally appropriate. We hear even from adults that we see, like people in their 40s and 50s who still don't understand the concept of death. And then it's really hard for them to cope with that as an adult. Whereas if we introduce these topics when they're younger and sort of talk through when somebody dies or when a pet dies, it means their body stops working, it means they can't talk anymore. Using child friendly language, but really being honest and explaining these things, it helps with the overall coping process. So we have resources in our resource library, which I'll share a link for at the end of the presentation, but we have lots of different ways to teach coping skills using visual supports. We have things like communication boards that give the opportunity, if maybe verbal communication is difficult for your loved one, they can use a communication board or a device. We have things like making a plan for what to do with my feelings. When something makes me angry, I will take deep breaths. I will talk to my mom or go for a walk so that I keep my cool. And then we have things like strategies to control my anger. So feel free to take a look around our resource library. All the resources are free to use as you see fit. All right, so another topic in childhood that is really important is the idea of social skills and boundaries. Some issues that we see with that are lack of awareness of appropriate social skills or boundaries. This is just something that maybe they are not even aware of, what the expectation or what the cultural norms are. Another issue is vulnerability of the Down syndrome population, because they may need support from caregivers for activities of daily living, hygiene procedures, and some individuals may have limited communication. We also see that exposure to opportunities for practice can be an issue of concern when learning social skills and boundaries. So, some strategies that we recommend are that social skills are skills that need to be learned and taught. So, they may need explicit instruction to learn social skills that people without Down syndrome or without an intellectual disability may just pick up on naturally through life experiences. Our folks with Down syndrome may need more instruction and visual support to help them understand some of the more nuanced things that go into social interaction. Um, in childhood, we talk about things like, waiting turns in conversation, using kind words, sharing, and these might be some areas that end up on a child's IEP at school, but then they can also be taught at home. Um, we want to talk about bodily autonomy and consent. And this is a little bit of a soapbox issue for me because I think it's so important and it really does start in childhood. Um, you may have noticed that many people, certainly not all, but many people with Down syndrome tend to love to share affection. They might like to hug or give you pats on the back or touch your hair. Um, and so it's really important for us to teach the importance of personal space and consent. We want our loved ones to know that they need permission to touch others, as well as others need permission to touch them. And that really does start in childhood for lots of reasons, primarily also, safety, but then we also want to set good habits from a young age that go on through adulthood. Um, we know that kids in general are still just learning about their bodies and they express themselves through touch, whether it's affectionate or even aggression. We know young kids sort of express their anger through pushing or hitting. So it's never too early to start working on ways to help them learn to keep their own bodies safe as well as the bodies of other people. So ways that we can do that is we want, as caregivers, ask permission before touching their bodies, even if it's, helping them in the bathroom or in the bathtub. Say, is it okay if I touch you here? Or I'm going to clean you here. Is that okay? Um, so this is something that they can learn that everyone is expected to do, is expected to ask permission and get consent before touching other people. Um, this is really important for our folks with Down syndrome because we do see that element of vulnerability that they may not be able to communicate as well with if something is amiss or if they're uncomfortable with certain attention or if touch. So we really want to teach them to be able to speak up for themselves and to keep their hands to themselves. Finally, opportunities to practice social skills with people of various abilities. So we know that if an individual is in a special education program, they may be with individuals whose skill levels are either similar to theirs or dissimilar. And so it's important to have the opportunity to practice social skills with others who will help them learn and promote positive social skills. So that's just something to consider as we're looking for social opportunities. And again, we have some resources that teach social skills and boundaries, things like personal space, what are friendships, rules for conversation. These are just a few examples of, we have quite a few resources on social skills and boundaries. Next up, talking about the Down syndrome diagnosis. We know that there are concerns. We hear from families that talking about the diagnosis or talking about having Down syndrome may impact self-esteem. There may be some confusion about what does that mean or why do I have Down syndrome, but my siblings don't. We also hear that there may be some feelings, whether they're feeling left out from their peers or they're in the middle. This is something that we hear adults talk about where, throughout their education experience, throughout their childhood, they um, they didn't fit neatly in a certain category, whether it's because they were more verbal than other special education students, but they weren't in the same classes as their general education peers. So that we hear that that was an issue of concern growing up. So some strategies for mental health promotion would be to just support a positive self-identity. We do recommend, making the child aware of their diagnosis. We've had some adults come to our clinic and when they see the sign, the Adult Down Syndrome Center, they say, wait, why am I here? Because it's never been discussed within their family about having Down syndrome and what that means. We recommend identifying and highlighting strengths, that all people have strengths, all people have differences that make them special and unique. We find that sometimes by not discussing it, that the individual then perceives that as it's a taboo subject or it's something negative or something bad. And so we do encourage talking about having Down syndrome and what that means. um, Answering questions honestly and kindly, right? We don't want to negate or deny that some things may be harder for an individual with Down syndrome, um, but we don't also obviously want to make it all doom and gloom, right? So we focus on acknowledging Down syndrome and what that means for the individual, as well as all the strengths and all the individual personal positive qualities that the individual has. We also recommend connecting with other people who have Down syndrome or intellectual disabilities, creating that sense of community and, making them feel comfortable interacting with people who have similar life experiences. Also important to get them involved in activities that they enjoy. We know that this is true for all kids, for all people, that when they have activities that they enjoy and that they feel good about, it helps with self-esteem and self-identity. In childhood, we hear from a lot of families that some concerns that they've had or experienced is the idea of fairness. You know, how do I treat or punish or support my child with Down syndrome compared to their siblings who don't have Down syndrome. Um, Parents learning ways to parent children or to parent their children differently based on their different needs, and the division of time between siblings. We do hear families say, so much of my time and attention have gone to my child with Down syndrome. How can I make that more equitable or more fair for all of my children? So some strategies for mental health promotion are, finding a balance. We hear from families the whole spectrum of experiences. Some families say, oh, I didn't treat my child with Down syndrome any different than I treated my other children. And then some people do say, well, my child with Down syndrome probably got a lot of privileges or perks that they didn't have chores or we didn't put certain expectations on them. So the most positive outcomes that we hear are really about finding the balance somewhere between those two things, two ends of the spectrum where they're no different and they're very different, somewhere in the middle, right? We want to consider fairness and abilities because fair does not mean equal. In some cases, some children, whether they have Down syndrome or not, will need additional support. And so providing each child what they need is a really positive way to go about that. Also considering differences in personalities. Some individuals with Down syndrome are super easygoing. They go with the flow. They follow directions. They're rule followers. Others, not so much. And so we want to consider their everyone has a different personality, whether or not they have Down syndrome, and adjusting parenting expectations to to meet those needs. We also really want to encourage positive sibling interactions, finding ways that the siblings can work together, enjoy their time together, because we know that sibling relationships are really important, especially as the individual with Down syndrome, especially as all the children age. We see what a positive and protective factor it can be if there is a strong positive relationship between the siblings. So finding ways that they can work together, spend time together, not in a competitive manner. So moving on to adolescence. There's a lot going on in adolescence so that we can talk about. Um, Puberty and sexuality is a big topic that comes up with our adolescents that we see here at the center. And some issues of concern are puberty and changes that they're going through. That's physical changes, mental, emotional, behavioral changes. We hear that some caregivers, parents, family members are not comfortable in discussing some of these tough topics, or they are unsure of how to explain it to their loved one with Down syndrome. And we hear that safe and healthy expression of sexuality or sexual urges is a concern for our patients. So some strategies for mental health promotion are talking about it before it begins and what to expect, right? Letting the individual know what is normal. Your body is going to be going through some changes. Your mind will be going through some changes. There's a lot going on during this time of life. So preparing in advance so that there's not that element of surprise is often very helpful. Um, we want to normalize the changes, say this is not just you going through this happens to everybody at some point in their lives, and it happened to your parents as well, maybe a sibling or two. So we can normalize all of these changes and help them feel more comfortable discussing it because it's not a taboo subject, it's nothing bad, and they should know that as well. We want to support healthy habits by teaching skills. These are, skills that they might not learn in other places. Things like for girls, changing a pad, you might need to set up a schedule or reminders for them to know when it's time to change their feminine hygiene products. For boys, you might need to talk about what to do, for example, with spontaneous erections. How can you, in a socially appropriate manner, how can you manage that? We also want to teach good hygiene because these are skills that they might not learn from anybody else besides parents, right? Things like privacy, if you're exploring your body, or if you're, taking care of some of these hygiene situations, make sure you're doing it in a private location, you're washing your hands, you're making sure your clothes are clean. These are all really important skills that need to be taught. We want to remember that people with Down syndrome have same or similar urges and reactions as people without Down syndrome, but they might need the support and explicit teaching from their parents to understand some of these concepts. Um, we hear from schools, sometimes schools will reach out to us and talk to us about there's maybe some inappropriate touching going on with a student, or they need to figure out what to do when the student becomes aroused. And so we all went through puberty and know it's a tough time. But imagine going through it without some of the executive functioning skills that we have, or the problem solving skills. And so we need to really help teach and develop these skills in our loved ones with Down syndrome. We want to encourage you to become comfortable with having uncomfortable conversations. And the thought process behind that is many people with Down syndrome rely exclusively on their family members for all of this information. Where in the general population, we may have learned it from friends or for things we've seen on the internet, what have you. Our loved ones with Down syndrome may not have all of those opportunities. And so it really does come down to the family being able to answer questions and to be comfortable talking about some of these tough topics. Um, let's see. We want to promote health, safety, boundaries, and consent. This is again going back to that childhood conversation about teaching about the body, using anatomically correct names for everything, making sure they understand ways to be safe and healthy, putting those boundaries and consent in place. We know, again, going back to the urges, we hear a lot, from our high schoolers, the schools have concerns about inappropriate touching. Well, they're the urges are the same as any other 17-year-old boy. They just need the reminders to how to manage those urges. We also recommend monitoring internet use. Not to say that they can't have access to the internet, but we want to make sure that they are aware that not everything you see on the internet is true, and that's not reflective of necessarily what other people are doing or should be doing. Um, so we do hear that, sometimes they come across some inappropriate content and they don't know if it's normal or not. They might get the wrong impression of what some things related to sexuality or puberty might be. And so you might want to monitor internet use and make sure you're having regular conversations where they can come to you if there are questions, so that you can clarify things for them that may be confusing. All right, we get some teenage rebellion in those adolescent years. So, issues of concern are that we, as caregivers, want to allow for desired independence while also considering the safety of the individual and their ability levels. We hear that frustration of caregivers and school staff with new behaviors or moods, things like, oh, they were just so happy all the time, and now they're really kind of cranky or grumpy or not, or they're refusing to engage. And behavior specifically towards their parents. We hear about that a lot. So, some strategies for mental health promotion is to remember that unfortunately, it is a normal stage of development. Teenagers are teenagers. Um, we have to remember ourselves or other children going through this stage of development. And oftentimes, when we have families come in saying, we have all these behaviors or these moods, we ask, well, when your other kids were going through this teenage phase, did they do the same thing? And that sort of clicks that, yeah, it is. It's similar in some ways and maybe a little bit different, but we do know that being a teenager is tough. And so we may see some of these undesirable changes. We know that in some individuals with Down syndrome, it may have a later onset than in people without Down syndrome. So, and it can last a little bit longer. So we do have some people coming in with their young adults saying, aren't we past this teenage rebellion stage? And unfortunately, it may go on a little longer or start a little bit later in some folks with Down syndrome, but knowing that that is still part of the normal developmental process. We want to provide then safe opportunities for independence. So, things that I've suggested to family members who are maybe concerned about the independence of their teenager or adolescent is dropping them off at a safe place with friends. So, if it's Starbucks or the movies and having a set time for pickup, I hear from a lot of our patients how much they crave that. And, parents, while very well meaning, say, oh, well, they don't go anywhere without me, or when they're out with a friend, I sit a few tables over. And some people do need that level of support, but also from the patient perspective that I hear, they still feel like that is not as independent as they would like to be. So, just something to keep in mind about ways that you can provide those opportunities for true independence. Um, Picking your battles. This is something that we all deal with as parents, right? Letting them have control over things that are really not as important, like the clothes they wear. We live in Chicago and it gets cold, and we do have some patients show up in their shorts in the winter, and their parents have just picked that battle, saying, you know what? I'm going to let you have this one. And that is a good way to allow them to rebel in a overall safe way. um, we also say it's important to allow for safe, natural consequences. This is a part of the learning experience, getting those natural consequences. For example, if you choose to wear shorts on a 15-degree day, you're probably going to be cold, you're going to be uncomfortable. And allowing that to happen so that they can learn from their own experience. Otherwise, you're probably going to be in a battle trying to convince them what to wear, what's appropriate, and you're just going to be the bad guy and they're not going to want to listen to you. But if they get that experience on their own, it's much more likely to stick in their mind for the next time. Um, Firm boundaries can remain for non negotiables. We do know that that goes along with picking your battles. If you notice that in your household or within your family, you have a lot of non negotiables, you may want to consider reassessing which are the most important to focus on, because we tend to see that when there are a lot of rules in place, a lot of non-negotiables, whether it's you wake up at a certain time, you eat at a certain time, you wear certain clothes, you complete certain chores. When there is a lot of non-negotiables or a lot of inflexibility, that we get a lot of pushback from the individual, and we can see that that can really negatively impact relationships for the long term. So that's why we say it's okay to have certain things that are non-negotiable and that you feel really strongly about adhering to, but also assessing which ones are maybe truly more important than others. Okay, so we know a lot of individuals with Down syndrome engage in sort of fantasy worlds. They imagine sort of other places where they go off into in their minds. And some issues of concern are that there may be a lack of awareness of what is reality, right? It goes from acute daydreaming about a crush to really thinking that they are truly in a relationship with this person or married with a family to this person. So there's a concern that, do they really know what is reality? We also hear that there's maybe too much time spent zoning out or fantasizing or engaging in self talk. Or when they are in a social situation, they're only talking about their fantasy world. And then going along with that, some refusal to engage in real life activities. So some strategies. First, with the note of that it's an example of it's not a problem until it's a problem. All of us slip into daydreams or fantasies from time to time, which is totally normal. People with Down syndrome have very strong visual memories, as I noted, so it can become very real for them. However, from the patients that I've worked with, we hear that fantasy provides an escape, an opportunity to process or get different types of social interactions, have more control, be accepted in different ways. Those are just some of the things that I've heard from the patients that I've worked with when their families express they're spending too much time in la la land. And then I get to meet individually with the patient and they say, this is my opportunity to have control over my life in my fantasy world, or this is my opportunity to explore what a typical boyfriend girlfriend relationship would look like that I don't get in my everyday life. Um, so we want to try when this comes up to keep clear boundaries between fantasy and reality. Some families I've heard they may play into the fantasy, but this can be confusing for the individual with Down syndrome. So things like, oh, yeah, Zac Efron is your boyfriend. I know. But we want to remind them that that's not really the case because they can, one, if they're hearing it a lot in their day-to-day life, they may get confused about what is real and what is just part of their fantasy. And so we can remind them saying things like, it would be nice to have Zac Efron as your boyfriend. That's something that you wish would happen. But then sort of drawing back into reality, being like, oh, so you're looking for a boyfriend, or you're wanting to be with someone who's cute or funny or nice. Um, Bringing it back to reality. Um, we've had some families again play into different fantasies, like things about like supernatural abilities or superpowers. Um, and then those beliefs become really internalized and hard to sort of break. So when possible, try to keep the boundaries of what is fantasy and what is reality. We also know that keeping the individual busy with various activities is a good strategy for breaking that going off too far or too long into fantasy land, and specifically activities that do not allow them to drift off. So, like a lot of our patients really like coloring or drawing, and while that's a great activity, it does still allow your mind to wander while you're engaging in those tasks. So if you're concerned about how much time they're spending in their fantasy thoughts, then finding activities that require more attention or socialization can help reduce that. Um, we also want to monitor screen time. So you want to be aware of what they're watching, how much they're off watching, how often. Sometimes we hear that people are slipping into a routine of watching the same thing over and over and over, which can then intensify the fantasies, their thoughts about it. And we want to be aware of any themes or content that they're watching. We hear a lot from our patients that they might be watching shows that really further blur the boundaries of fantasy and reality, or that have scary themes that might cause them distress. So, really, just sort of watching and paying attention to what they are watching on TV or on their computer. Finally, we want to consider what their fantasy world provides for them. So, is it a sense of calm? I had a patient who her fantasy world was the little town of Stars Hollow, I believe it's called, from Gilmore Girls. And she loved thinking about that because that was a calm, soothing place. I had another patient who imagined herself more in control of her relationships, and there were people who just wanted to be her friend. She imagined herself basically, as she said, not having Down syndrome. So people would interact with her differently, and she could sort of imagine herself in that way. So, what does the fantasy world provide for them? Is it calming? Is it control or power, desired relationships, independence and freedom? And then, is there a way to help support some of these desires in their real life so that they don't have to dive so deep into the fantasy world in order to get those needs met? Next is the idea of inclusion. So some concerns that we hear about throughout childhood and adolescence is either is feeling left out from their same age peers, difficulty coping with changing relationships, and their self-esteem related to being included with their same age peers. So some strategies for mental health promotion are that we want to promote friendships and connections with other people who have Down syndrome or intellectual disabilities. And we see that this is really important. This is a common issue that we hear after high school graduation, that if the individual with Down syndrome was primarily with their general education peers, once those kids all graduate and go off to college and start a different part of their life, the individual with Down syndrome sort of feels left behind or left out and feeling like they're missing out on a part of life. So we think it's really important to have connections with other people who have similar life experiences, maybe who are going through the transition program themselves or who are looking for work after high school. So it's good to be able to support each other in that way. We also want to prepare and set expectations for how friendships may change throughout life. Again, after high school, this is a major mental health concern that we see, that the individuals with Down syndrome are really sad, um, even getting to the point of depression based on the fact that, well, I used to talk to this friend every day. We used to text all the time. We used to hang out. Then they went off to college and now I don't see them anymore, or I only see them once in a while. So we want to sort of remind our loved ones that for all of us, relationships change throughout life. People I was best friends with in childhood, I'm not best friends with anymore. I have new friends. Friendships come and go, relationships change, and how to cope with that. So we want to then, going along with that, provide regular opportunities to meet, connect, and engage with other people. So after high school, after graduation, looking for opportunities and programs that allow them to continue meeting new people and forming new friendships and relationships. Thinking ahead to the future, some issues of concern that we hear about regularly are that there are a lack of activities after high school or transition program, or there is uncertainty about programming or employment that the individual can engage in. And we hear from the individual with Down syndrome that they want to do all the things that their friends or siblings do. And so there can be that frustration if I'm not going off to college once I'm 18 years old, or I'm not getting a job because of my different situation. So, some strategies for mental health promotion are thinking about programming after high school and transition. Hopefully, if your loved one is still in school, the school staff are helping facilitate this process, making you aware of different programs or agencies in your area that can help with the post high school transition. Um, Thinking about what is best for your loved one. There are so many opportunities now, different program like day programs, jobs, activities. Some folks do go to college or do some sort of college programming. Um, if there's nothing available and you're on a wait list, try making a daily schedule of activities that they can do. We find it's really important to maintain um, levels of activity so that we're not getting into that post high school slump where, when you're in high school, you're in school for 7 hours a day sometimes, going back to back to back, getting lots of sensory input, social and socialization and learning opportunities. And then when that ends, we want to make sure that the individual doesn't just completely become isolated or completely sedentary. So, looking for ways to keep them busy, even if you don't have a program necessarily lined up yet after high school. We also think it's important to promote different lifestyles and goals. Um, Many people with Down syndrome want the lifestyle that they see around them. My brother went to college, he met a girlfriend, they got engaged, they got married. That is the goal. But we want to remind them that not all people go to college, not all people get married, right? And there are different opportunities for everybody to live happy and fulfilling lives. And so presenting those things as options just to get that on their radar. Now, they still may very well feel strongly about, I want to get married, I want to have kids someday, but it is also important to let them know that that's not the only way to be happy. That's not the only way to have a full life. And helping them work on skills that help them reach their future goals. We hear a lot from our patients that they have a lot of goals for themselves. They really want to get married, for example, but they don't recognize that in order to get married, you first have to be the best version of yourself so that you can meet somebody who wants to date you and be in a relationship with you in order to get married. They're really focused on that end goal, and we want to support them to get beyond that. So moving into young adulthood, going along with what I was just talking about post high school and transition, the issues are that there's a drastic change to schedule. We're not getting as much socialization. We're not getting as much input throughout the day. There are fewer opportunities for movement and socialization. Maybe they're feeling overwhelmed about the future. Now it's really sinking in after graduating high school. What am I going to do with the rest of my life? And what is their identity as an adult? What does independence look like for them? Um, we hear all the time, I want to be independent. I want to be independent. What does that mean for you? What does that mean for your family? So, some strategies for mental health promotion are finding ways to stay busy. We make all sorts of visual schedules for the patients that we work with about ways to fill your day, even if you don't have activities. Wake up, do your morning hygiene routine, eat breakfast, do chores, go outside, take a walk, things to stay busy throughout the day so that they don't fall into the trap of just sitting in their bed or sitting and watching TV all day. We want to look for continued opportunities for movement and socialization, things like Special Olympics or day programming, um, any opportunity to keep moving and to get out and about with other people. That goes along with continued learning. We want to make sure that their brains are still developing. We want to help them continue learning and having opportunities to try new things, learn new skills. And we want to discuss the meaning of being an adult and what it looks like to the individual with Down syndrome. We've heard all sorts of different definitions of what it means to be an adult or what it means to be independent. And oftentimes we find out that the family's definition and the individual with Down syndrome's definition are different. And so it can help to have conversations to sort of get on the same page about really what that looks like. How can we work together to support you in the areas that you want to be independent and make sure that you're understanding that being an adult does come with responsibilities. It's not just all the fun stuff as well. Life after school. So we hear from families that I didn't know what the options were. I didn't know of these college programs, or I didn't know of this day program or this employment opportunity. We also know that even for families who are well aware of the options, there are long wait lists to get into various programs. Um, Depending on where you live, there may not be as many options. If you live in a more rural or secluded area, then there may not be local options available. And we also hear sometimes that there's a great program, but it's very expensive, and that cost is a limiting factor. So, some strategies for mental health promotion is discussing with school staff or local agencies what options exist, hearing from other families, maybe things that they've done or contacts that they have that help them connect with various agencies. That can be a really great strategy. Um, and then filling the schedule as much as possible with even if it's just, hey, we're on the wait list for this day program that will be really great, but we it might be a year, it might be 6 months before we get in. If there's like a class you can take, or anything that they can sign up for as much as you can, because that will just make the transition to more programming easier. We're as an adult, we want to maintain habits and skills. We hear sometimes that there's a lack of opportunity to practice skills or the lack of need to demonstrate habits and skills. Some folks say, well, yeah, they used to be great at waking up at 7 a.m., getting dressed, having breakfast, brushing their teeth, doing the whole thing. But now that school's over, there's no reason for them to demonstrate those skills. And we sort of see how that has a spiral effect. If there's no need to get up early in the morning, there's no need to go to bed at night. So they stay up till 1 or 2 in the morning. And then we see sort of other health impacts, or behavioral mental health impacts from that. So some strategies are to continue to hold the individual to standards, right? Like if you were getting up at 7 a.m. before, we're going to keep doing that or only modify it slightly. You want to create motivation or reasons for the individual to continue demonstrating their skills. So finding a reason to get up and out of bed in the morning, because we find that our adults are really aware that, hey, if I could stay in bed all day, I would love to, for some of them. So we want to then create a reason to still engage in the habits. We hear a lot about hygiene, like, well, I'm not going out today. I'm not seeing anyone, so why do I have to shower or brush my teeth? So using like visual schedules, creating motivations, trying to get out of the house every day so that they at least have that reason to get up and out of bed, to get dressed, that helps them maintain skills that they had before. And encourage the development of new positive skills, doing things like signing them up for new classes, art classes, music classes, anything that can help them learn new skills. Um, Going along with, let's see, motivation, creating motivation, that might be the case that, like, okay, well, cell phones or tablets stay plugged in until we're up and out of bed and dressed, because we all sort of need that motivation. So I don't want people to think about it as, oh, we're infantilizing or we're treating them like a child. sometimes we all need motivation to get out of bed and to get going in the morning. And so that would be an acceptable way to help your loved one with Down syndrome. We also hear about in adulthood the comparison to peers and siblings. An issue of concern is wanting to be on the same timeline as others. Oh, my sister got married when she was 24, and I'm 24, so that means I should be getting married now too. There may be feelings of disappointment, sadness, or anger, and the impact on the self esteem if they're not reaching the milestones that other people are at the same age. So the strategies are help with goal setting. Again, what are some things that you have control of that you can work on to help you reach your long-term goal? We also want to praise accomplishments. Everybody's accomplishments are different, and we want to recognize that in our loved ones with Down syndrome, they have many great accomplishments as well, and they should be celebrated. Recognize achievements outside of the quote unquote typical ones. It's not just about graduating college and getting married and buying a house. There are lots of different achievements that people go through, whether it's completing a class or signing up for a new program. These are big achievements and they should be celebrated as well. Discuss different options for a fulfilling life. Like I mentioned before, that we don't necessarily have to follow the same path as our classmates or our siblings did in order to be happy, and discussing that those things are an option. We also want to validate feelings and experiences, knowing that yes, it is frustrated if all of our friends or all of our siblings have, reached certain milestones that we haven't. And so we can validate those feelings and their experiences. Individualism is a big issue of concern because adults have different opinions, thoughts, beliefs than their family members. And a concern is that they want the ability to explore their individuality while living at home or with other people, and that may be in conflict with the other people they're living with. The concept of independence versus safety, and conflicts within the home. So, some strategies for mental health promotion are to allow the individual with Down syndrome to try to do things their way, right? There are things that all of us do that our parents did differently or the people who raised us did differently, but just because we do it differently doesn't make it wrong. And the same should go for our loved ones with Down syndrome. If they have a certain style or a way of doing things, it's not harmful to them or anyone else, then they should be allowed to explore that. So again, assess if it's problematic or just different, and provide necessary information. Sometimes they don't have all the information in order to make safe choices or independent choices. So if you're giving them that information, that allows them to sort of learn and make informed choices. And again, back to natural consequences, it's important for the individual with Down syndrome to experience the natural consequences of their choices. I hear from a lot of patients that that's how they learn. They want to learn through their mistakes. And sometimes, as family members, we're too worried about letting them make mistakes and we try to prevent that, but it really is an important way for them to learn how to do things. Adults worry about friendships and romantic relationships because these things change over time. We know that there's often drama amongst friend groups. Yeah, the whole dating scene is always a conflict. I know we hear from all the time about love triangles, love squares, love pentagons, where everybody's engaged or dating, and that can lead to some drama. Or just in general, we hear also that there's a desire for a romantic relationship and they just haven't found a person that it's working with. So some strategies for mental health promotion are allow friendships to change. This is true for all of us. Some friendships are really strong and last for the duration of our lives. Others don't, and that's okay. So sometimes parents may really try to push like, oh, well, you've been friends with them for so long, knowing that sometimes our friendships just change and that's okay. We want to teach social skills related to friendships, boundaries, and dating. We have some really great resources in our resource library to help with that. And we want to provide opportunities to meet new people. It's really frustrating for a lot of our folks that they are interested in friendships or interested in dating and just don't have a wide enough social circle. So now with technology, that's a really great opportunity to meet new people. Like, for example, we host virtual groups so people from all over can connect. And that's a really great way to meet new people and to get to know some new friends. Moving into older adulthood, Concerns are maintaining habits, that there's maybe a loss of interest or a loss of function and mobility. So, some strategies for mental health promotion, if these are issues of concern, are continuing finding opportunities for engagement. Um, we want to figure out if there's a loss of interest, why that is. Is it a health related issue that a doctor should be made aware of, or is that just a change in preference? So, continued engagement is really important for mental health. And we see this with our older population a lot, and we hear from our families, even with their loved ones who have developed Alzheimer's disease, that the socialization piece is really huge in promoting their mental health. Um, so we don't want the individual to get caught in a cycle of not going out, which then leads to isolation, which further impacts mental health. So even if they're slowing down or mobility is an issue, we still want to find opportunities that they can still engage with others. We might have to make adjustments as necessary, but we don't want to totally eliminate activities or opportunities. So like if mobility is an issue, if like they can no longer cook for themselves or go out and about, we still want to allow them to participate in meals, so they can maybe set the table, or they can just sit with the family or serve themselves or others. We hear times that like, oh, well, they don't want to come sit to the table, so we just bring all their meals up to their room. But then we hear that that really negatively impacts their mental health when they're missing out on normal opportunities to socialize. And we want to hold expectations as their abilities allow. Some folks, as they get older, they figure out that, hey, my parents or my siblings or my caregivers will do more things for me if I just say I don't want to do them. And then, even though they're capable of doing it, they aren't. So we want to make sure that if they are medically capable of doing things, that they continue to do things for themselves rather than other people stepping in and doing it for them. So that goes along with slowing down. Is it their ability, or is it a behavior that they're choosing not to engage in certain things? It is a normal part of aging that we all slow down as we get older. And so we can accept that, and we can, allow for that as necessary. But we also hear it's a concern that some caregivers have difficulty then supporting the individual, whether it's because of mobility or just time commitment in caring for their loved one. So, some strategies for mental health promotion are working with medical providers to assess. The medical providers may be able to tell you if there's a functional decline due to medical status or mobility, and they may provide ideas for supporting the individual. If a family member is not able to meet needs, consider home health services or respite workers, because it's really important for the family to take care of themselves as well. Allow for slowing down while not completely eliminating activities. Again, this is sort of what I said before, that when we all slow down when we're older, maybe they don't go to Zumba class anymore, but now they're into bingo or bunko, and that's okay as well. So we know that this is just a natural part of the aging process. So this is part of life throughout the lifespan, but in older adults, we hear some issues, concerns like there are some unpredictability of changes, many changes happening at one time, or individuals with Down syndrome are not open to certain changes. And so um, we recommend making changes one at a time when possible, and preparing the individual in advance. So if we're talking about like, well, you lived with mom and dad for your whole life, but now mom and dad are getting too old or are no longer able to care for you and meet your needs, what is that going to look like? Are you going to move in with a sibling, or is there a residential opportunity for you? We don't want to make lots of big changes all at once, but taking small steps can make it feel more comfortable. So like if they're moving to a new place, maybe spending some time in their neighborhood that they're going to move to, talking about it all in a positive way. Just being careful with how you approach the topic. For example, um, saying things like, when mom and dad get too old and sick to take care of you, you will live here. That might cause some confusion, like, oh, are you sick now? What is this happening now? We just want to make it a positive experience, changing one thing at a time. Um, Provide encouragement about things that will remain the same, even if you're not living in the same home or engaged in the same activities. There will be some things that remain the same, like you'll still have holidays with your siblings, or you'll still get to go on vacations. Whatever that might look like can help put their minds at ease. And we want to put supports in place before the changes happen. We hear from some families that they want to keep their loved one with Down syndrome in the family home for as long as possible until a caregiver either is no longer able to care for them or passes away. And while that makes sense financially and emotionally and logistically for a lot of families, we want to, sort of plant the seed of thinking about that would mean a lot of changes happening all at the same time. So if we're grieving the loss of a family member and we're moving to a new place and we're sort of uprooting the things that we're used to, that can be really traumatic. So we want to put supports in place before the changes happen to prepare in advance. So finally, I just wanted to briefly talk about treatment approaches for promoting mental health. There are things like counseling, medication, behavioral therapy, occupational therapy. And so we want to address needs as they arise, right? And so there's no right or wrong way to go about whether, you get counseling or go through medication. We say the most important thing is to rule out medical concerns first. Some families then like to try counseling before starting medication. Other families say we need medication to just get them into the therapy treatment room, and that's okay too. Um, Behavioral therapy can be a really great support because many behavioral therapists can come into the home and teach skills to the individual in that environment or out in the community. And so that's a really great support if that's available. Occupational therapy. I work really closely with our occupational therapist, and in some situations, it's a fine line between like sensory needs versus mental health concerns, and sometimes working together with an occupational therapist can be really beneficial. Um, you do not necessarily need to work with someone who specializes in treating people with Down syndrome. So one thing that we do with the importance of this education is as caregivers or family members, you can sort of work with different providers, whether it's a therapist or a physician, talking about the common characteristics and what we know about people with Down syndrome so that they can apply their techniques to the individual. So there's no right or wrong way to do it. And if you talk with therapists or providers, they may be able to point you in the right direction. So just really quickly wanted to point out that these are links to our resource library, all of our resources, mental health and social skills resources. This is my contact information in case you have any questions or concerns. And here we have again for your easy viewing. We have a Facebook page, an Instagram page, and an email newsletter where we share information about the things we do like webinars or the social skills groups that we offer. And so I don't know if I know I talked a really long time, Donna, but if there are any questions, I'd be happy to answer them.
Thank you, Abby. That was fabulous. And I have to say, what I need from you is how do I just incorporate all of those great things in my life? Because not to belittle anything, but it's all basically common sense.
Mhm.
But we just have to remember to implement those things for our loved ones with Down syndrome, and it does, and it can work. So I do want to say thank you again. And I will tell everyone that the resource library is phenomenal, and it's everything from downloadable picture guides to webinars that have been presented, short articles on certain topics. Another thing that is fabulous is Abby works with Dr. Brian Chicoine, who will be our keynote speaker at the Down Syndrome Conference in April. But Dr. Chicoine and Dr. Dennis McGuire wrote the book on mental health and adults with Down syndrome. I'm probably chopping up the title of the book, but if you are on the adult Down syndrome site, I believe somewhere on there is a link to their book. So if you have a child with Down syndrome, you may know of Woodbine Publishing. They were the publishers of a lot of books about Down syndrome. And unfortunately, as a family of an adult with Down syndrome, they wanted to retire and they just closed Woodbine House. A lot of the authors are finding ways to make sure that their information is still being disseminated. And Dr. Chacoin and Dr. McGuire have made their book available free for download. And one of the places you could find it is on the Advocate Adult Down Syndrome Clinic resource page. So that just goes along very nicely with everything that Abby shared with us tonight. So yeah, we have time for questions and answers. If anybody wants to pop their questions in the Q&A, that would be fabulous. But I want to thank Abby for spending her Wednesday night with us. I know she has young children, so I don't know if this is a night off for you or whether you're going to go home to mayhem. But thank you very much. That was all phenomenal. I do know you're new to the Adult Down Syndrome Clinic in Park Ridge, but Abby has already been presenting her presentations at the National Down Syndrome Congress Convention, or a conference that they have each summer. So hopefully we'll have opportunities to hear more from Abby, whether it's through the virtual speaker series or some of the other programs, and especially the resource library that you have. I know there's several webinars that have been presented by many of the staff there. So I'm kind of just talking, waiting for some questions to pop up. But if we don't have any questions, I think we'll just thank Abby one more time. There will be the follow-up email hopefully next week with the recording of tonight's presentation for any of you that want to go back and listen to that, as well as for PowerPoint slides. And as long as those PowerPoint slides are converted to a PDF, all your links in the PowerPoint slides should work to all the resources you shared. Okay, so with that, I want to thank everybody for joining us tonight. Please, again, be on the lookout for information about the conference. And we have a fabulous conference planned.
Thank you so much. It was wonderful. I'm sorry to interrupt you. Really, really enjoyed it, and I found it very helpful. I took notes, and I'm going to implement a lot what you said. Thank you.
Good, thank you.
Okay, well, with that, I will say good night to everyone, and hopefully we'll see you either at the Down Syndrome Conference or we'll see you at the next virtual speaker series that should start again in June. Abby, thank you. Good night, everyone.
Thank
Good
you.
night. Thank you again.
Thank you.
Bye-bye.